Chairman, good friends and supporters in the gathering, Mrs. Padmaja from MD and CEO of Indian Bank, Dr. Prakash from Star Insurance, Mr. Pavan Chobe from the Health Insurance TPA, Ms. Giada Bono from Banca Stella, Mr. Thomas Simon, TCS, Mr. Suresh from Sistema, Mr. Arup Sinha, Mr. Ramesh, Mr. Sunil Kumar, Mr. Murli and David from Danfoss. I'm mentioning all these names because without the support, the partnerships, I don't think we could have done a lot of things which we set out to do. And I must also welcome and thank the members of the press. From the time we started 36 years ago, the media has been literally the strongest arm of Apollo when we wanted to communicate and disseminate knowledge and information. I'd also like to welcome all the senior doctors, literally the Apollo support system, and of course Sunita and Upasna and the rest of the team, because unless we work together as a team, this problem is huge. You know, there's no underwriting the magnitude of the problem, and this war on NCDs is something which we cannot fight singularly and we have to fight together. So the journey of healing actually began 4 decades ago, and this whole plan, thought, idea germinated actually in St. Mary's Road in HM Hospital, with our chairman saying that, you know, we need to do something about prevention. So it was the word master health checkup, which was, and you know, we still have that sign. We've saved it because it's part of our religion and our legacy. And that's how it started. But now it's become literally a household name. Sometimes we think, why didn't we patent it? Because, you know, the brand value of master health checkup has now become global. It's available anywhere in the world. The government hospitals have adopted it as their program. So every year, there are millions of people who are actually being screened under different names, different avatars of the Master Health Checkup. But the word Master Health Checkup, we must take pride in it, that belongs to Apollo. And, you know, it's part of the Apollo legacy. And it is 4 decades old. And today, in a world where we are talking about data consortiums, data lake, AI, so on and so forth, if there had actually been a plan to store all that data and use it for the greater good, it would have been like a multi-billion-dollar enterprise. I'm saying this because, you know, when we put material terms and when we put finance and figures to the human body, Chairman comes up to us and says, do you know the value of the human body? And he's going to tell us that. I'm not even going to attempt to say what the value of the human body is. So however many $1 billion a name or a brand is worth, every human body is worth 1 billion times more than that. And I'm just laying this on the table because that is the magnitude of what we're taking up to do. We are daring as an organization. The Apollo dream itself was completely daring. Nobody dared to do something like that in India at that time. But today we have a healthcare ecosystem in the country which the rest of the world looks at, which the rest of the world is coming to for answers. You know, that is how India has grown and blossomed. And it has been because everybody dared to dream, everyone worked together and said, high quality healthcare is a fundamental right of every human being in our country. But then we have to come back and think and say, do we want illness to really be an answer? Do we want people to be ill and come and fill our hospital beds? Do we want illness to be a multi-billion-dollar industry? What if we think differently and prevent illness? Can we prevent people from filling up hospital beds? Those who really need it were there with high quality healthcare. But can we prevent the onset of disease? And ladies and gentlemen, today an idea which germinated 40 years ago as Master Health Check has now become a responsibility of the Apollo Group to look after your health, your employees' health, your family's health, the health of your social circles, and your own health. Because unless you look after your own health, you can't do much. Famous saying, Shariram Adhyayam Dharma Khalu. That means that the body is the instrument of all the good deeds you do. So if you don't look after your Shariram, if you're not responsible of your own health, there's not much you can do. Having said that, I'd like to thank you all and welcome you to this very momentous launch. To us, if Apollo Hospitals was one giant leap for mankind, today this launch, ProHealth, is one giant leap not only for mankind but for the globe at large. Thank you all for being here.